Tech giant Google is coming under fire for a project which allows them to gain access to the medical data of millions of Americans. One America's Jack Posobiec reports.
We are super excited to welcome back here to One America News Rachel Bovard, Senior Advisor for the Internet Accountability Project.
Thanks for having me.
So there's this new news that's coming out, a revelation really from a whistleblower, believe it or not, about Project Nightingale, this new project for Google. Can you break that down for us?
Yeah, so essentially what happened here is Ascension, which is a charity system of hospitals, made a deal with Google. And as part of this deal, they passed along all of the medical records of their patients. And that includes all your health records, patient names and dates of birth, gave it to Google for some kind of efficiency purpose, right? They are trying to make their system more efficient. But the trick here is that neither patients or doctors were informed or gave any consent for this kind of data transfer. And so you may say, what is Google doing with this data? You know, they won't say. And that's really concerning to a lot of privacy advocates who say, well, this is technically in compliance with HIPAA. You know, we don't know what they're doing with this data. And if there were to be a privacy violation or the data was misused, the patient and the doctor had no idea it was there in the first place.
Now, there's also a concerning angle of this because Google also essentially just purchased Fitbit last year.
Yeah. So Google is really trying to get into the healthcare data space, and they purchased 28 million users' data from Fitbit. Again, they don't want the wearable technology. They have that already. They just want the data. And again, Google isn't saying what they're doing with it. All they'll say is, well, we take privacy very seriously. But that's pretty unsettling when you consider that Google is untrustworthy actor when it comes to data. They've said they were going to protect data in the past, then they commingle it with other data. We suspect, or the majority of consumers suspect, all of this is going toward ad revenue because Google makes 90% of its revenue from targeted ads. What better use for this data than to create targeted health ads? But the problem is they haven't gotten consent from anyone to use this data.
Not only that, but one of the issues I can see is sharing your health data with your employer or sharing it with any large corporation when it comes to the hiring process. So now when I'm looking at my workforce, now when I'm looking to hire people, I can have access to their data and then I can start choosing and racking and stacking candidates or employees based on their private health records, how many steps they did this month. You know, what is going on with this?
Right, there's a whole ton of discriminatory outcomes you can think of that data would help people make those decisions. People have been very worried about this with genetic data. They don't want healthcare companies discriminating on the basis of genetic data. So why are we okay with giving our data to Google and allowing them to use it for whatever they want? Not just ads, but as you point out, sharing it with employers or creating apps around it or all those things. Again, this is nothing that we gave our consent for. In the case of Ascension, patients didn't even know about it. Now, we can say that HIPAA allows certain things like this, but remember, HIPAA was written in 1996, before any of this data transfer was envisioned, and certainly not at this scale. So I do think Project Nightingale raises a question over whether or not our public policy and our laws need to be updated to reflect this kind of sharing and mass scale data transfer that we're seeing now.
And Ascension, they're the same Catholic system that was really working with the Obama administration for Obamacare, the ACA.
Yeah. Again, you're getting into motives that are unclear, right? What does Ascension want to do with this data? Why are they partnering with Google? No one is really giving clear answers here, and a lot of consumer and privacy advocates say that's a problem.
Rachel, where can people go for more information?
You can follow us online at theiap.org and on Twitter.
Thank you so much.
Thank you.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube. And call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.